growing crisis. More children are facing severe flu complications and deaths as vaccination rates drop, CDC warns. Christine Ware's voice carries a palpable sense of worry as she talks about the approaching flu season. Anxieties are running high, she admits. We're all trying to figure out how to live normally without retreating into a protective bubble. Her concern is deeply personal. Christine's 4-year-old son, Beckett, is still on the road to recovery from a flu infection he caught back in January. Within just a week of falling ill, Beckett became dangerously lethargic. He couldn't move his head or arms, and he lost the ability to eat or speak. Christine, 40, from River Forest, Illinois, recognized the severity immediately. This was not Beckett's first brush with a rare but devastating flu complication, acute necrotizing encephalopathy, ANE, a severe inflammatory brain condition triggered by the flu virus. This was his second episode. Recovering this time around has been a slow and challenging process. His brain is taking longer to heal, Christine explains. Back in September 2022, when Beckett first developed ANE, he hadn't yet received his annual flu vaccine. Interestingly, during his second diagnosis, he had been vaccinated. Research suggests that flu vaccines may be less effective for children who have already experienced flu-related brain inflammation, which complicates prevention efforts. What's alarming is that cases of pediatric ANE and other flu-related brain inflammations are increasing. The Centers for Disease Control and Prevention, CDC, recently released data showing that during the 2024 to 25 flu season, 109 children were diagnosed with this rare but serious complication. Even more concerning, the report reveals that among children with influenza-associated encephalopathy, whose vaccination status was known, a staggering 84% had not been vaccinated. This troubling trend coincides with the nation recording 280 pediatric flu deaths last year, the highest number since the 2009-10 H1N1 pandemic, and a noticeable decline in flu vaccination rates among children. We can't always predict which children will suffer the most severe flu complications, says Dr. Buddy Creech, a pediatric infectious disease specialist at Vanderbilt University Medical Center in Nashville, Tennessee. That's why we recommend flu vaccines for every child. It's a misconception to think only children with pre-existing health issues are at risk. ANE is extremely rare, with only a few cases reported annually, and it has never been systematically tracked before. However, this year, doctors have anecdotally observed a rise in children experiencing severe brain inflammation following the flu. We don't have exact numbers to confirm an increase, but as a physician treating these patients, I can say the rise is noticeable, shares Dr. Molly Wilson Murphy, a pediatric neurologist at Boston Children's Hospital and co-author of the CDC study, The Hidden Dangers of Flu-Related Brain Inflammation. The 109 children identified in the CDC study were all diagnosed with influenza-associated encephalopathy, IAE, a condition where the flu virus attacks the nervous system. Symptoms can vary widely, including confusion, difficulty walking, hallucinations, abnormal movements, and seizures. Dr. Wilson Murphy suspects there are at least 7 different types of IAE, with ANE, Beckett's diagnosis, making up about 1/3 of the cases. The severity of these cases is striking. 74% of affected children required intensive care unit ICU. Admission, 54% needed mechanical ventilation to assist breathing. 55% were previously healthy children with no underlying conditions. 19% tragically died from the illness. Flu is genuinely dangerous for children, emphasizes Dr. Keith Van Haren, a pediatric neurologist at Stanford Medicine and co-author of the study. This is not an exaggeration. Why are childhood flu vaccination rates dropping? Unlike vaccines for diseases like measles, mumps, and rubella, MMR, flu vaccines are known to be less effective at completely preventing infection. However, their true value lies in significantly reducing the risk of severe illness, complications, and death. Our goal as parents and healthcare providers is to keep children healthy and protect those most vulnerable from severe outcomes. Dr. Van Haren explains, getting vaccinated against the flu remains the simplest and most effective way to achieve this. Last year, flu vaccines were shown to be up to 78% effective in preventing hospitalizations among children and teens who contracted the flu. Alarmingly, about 90% of the 280 children who died from the flu last season had not received their annual flu shot. The best protection for yourself and your family against influenza is for everyone to get vaccinated, advises Dr. Sean O'Leary, an infectious disease expert with the American Academy of Pediatrics. Early data from the Southern Hemisphere's recent flu season suggests the vaccine has cut flu-related hospitalizations by half, underscoring its protective benefits. Yet, despite this evidence, flu vaccination rates among children have been declining. The CDC reports that only 49.2% of children received a flu shot last year, down from 62.4% during the 2019 to 2020 season. Dr. O'Leary points to multiple reasons behind this drop. Vaccine hesitancy is part of it, but many families face challenges accessing healthcare. Additionally, many clinics are struggling with staffing shortages, limiting their ability to offer convenient flu shot clinics during evenings or weekends. The CDC recommends that, with rare exceptions, everyone aged 6 months and older should receive a flu vaccine annually. For children like Beckett, who are especially vulnerable to severe flu complications, the importance of widespread vaccination cannot be overstated. Christine Ware stresses, it's easy to ignore the risk when it doesn't affect your family directly. But getting vaccinated is a simple, effective way to protect my son. So here's the question for you. With flu vaccine effectiveness varying and vaccination rates falling, are we doing enough to protect our children? Could more aggressive public health campaigns or policy changes make a difference? Or is vaccine hesitancy an insurmountable barrier? Share your thoughts below. This is a conversation we all need to have. Erica Edwards is a health and medical news writer and reporter for NBC News and Today.